ANA or anti-nuclear antibody test is done to see if there is presence of autoimmune disease. So ANA test is basically a screening test, and most people who have an autoimmune disease will have a positive ANA or a positive anti-nuclear antibody test. But then there is still a small subset of population that may have autoimmune disease, but their ANA test will still be negative. So that is something to be kept in mind. Now, why do we do the ANA test? Well, anti-nuclear antibody test or ANA is done to see if there is any problem that is giving rise to symptoms associated with autoimmune disease or inflammation in the body. And most of the time these symptoms are systemic symptoms. In other words, they involve the entire multiple systems in the body. So for example, there may be fatigue, there may be joint aches and pains, there may be skin rashes, there may be gut symptoms, there may be systemic symptoms of neurological problems, and then many others. So whenever this basic screening test is done, if it is done, it doesn't necessarily mean that a specific diagnosis is present. It just means that one of the three things could be going on, or actually one of the four things could be going on. So the first is that it's possible that it's just positive falsely. In other words, the patient doesn't have any problem and the test just happened to be positive, and that's about 3 to 5% of the population. Then people over the age of 60 or 65 can have a positive ANA test up to 30%. So that is another scenario that could occur. So that is the first one. The second thing is if there is a true autoimmune disease present. There are more than 100 different types of autoimmune diseases. The most commonly known ones are lupus or SLE, rheumatoid arthritis. There could be Sjogren's syndrome, could be autoimmune hepatitis, and there is neurodegenerative diseases that can be autoimmune. So there are many things that are autoimmune. So if an ANA is positive, then one of those 100 different types of autoimmune diseases could be present. The third possibility is that there is a chronic virus infection present, which is turning the body's immune system to create or make the ANA or the anti-nuclear antibody. So that chronic infection usually is in the form of viruses, but bacteria can also do it. So the viruses that are notorious for doing this would be Epstein-Barr virus, herpes simplex virus, HPV virus, and then many other different types of viruses. The fourth or the last thing would be anything that triggers the immune system can turn the ANA positive. So one of those things would be different types of foods. So whenever we are eating foods, our body may not, our body's immune system may not recognize these foods as normal or friendly to the body, and perceive these foods as foreign invaders. As a result, the immune system will go ahead and make anti-nuclear antibody. So any of these four possibilities is there. So just presence of ANA as a screening test doesn't necessarily mean that there is a specific problem. It just means that there is a sign that something is going on and we need to go ahead and do further testing.